068, on our 30-cent text line 0877 871 068. You can email us on air at sunshineradio.ie. Lyndsey Dolan with you till 11 o'clock this morning. Now, Calum has been in the news recently. He's starting to lose his hair a bit. Apparently, he's having secret treatment to stop him going bald. He's only 29 and he's been visiting a hair loss clinic in Ireland to slow down his receding hairline. He's been going to the Ailesbury Clinic in Dublin. Now, the clinic specialises in hair restoration using a specially designed implementation pen to place hair follicles at exactly the correct angle and direction. It's a non-surgical procedure. Dr. Patrick Treacy from the Ailesbury Clinic joins me live in studio. Patrick, you're very welcome. How are you?
Good morning, Lyndsey. I'm very well, thank you.
It's good to talk to you. Hair loss, now, it's such a common problem these days, not just for men, but women as well.
Absolutely. When people look at hair loss, I mean, obviously there are many different causes. There are up to 7 different causes of hair loss, but the one that we would tend to sort of focus on is hormonally based. This is what we call androgenetic or male pattern hair loss, but in women it is hormonally based as well. And it's interesting what happens, believe it or not, when people say, oh, people who lose their hair have very high testosterone levels. That is a bit of a myth. But what does happen is related to testosterone is that there's a chemical that makes testosterone. And when it circulates in the bloodstream, some hair is susceptible to it and it causes it to fall out, and some hair is resistant to it and that stays in place. But the fascinating thing about this is when you move the hair, usually from the back of the head that's resistant to it, to other areas, it retains its memory of being resistant to it, and so it doesn't fall out. So if we transplant hair, we have this fascinating sort of situation that we have hair that'll grow for the rest of your life, taken from another source. What we've done that is different is this. We have not single-handedly discovered, but almost among one of the few clinics in the world discovered, that you don't need to move up sweat glands, you don't need to move up blood vessels. If you move up the follicle on its own, it retains the memory. And this has opened a whole new world, because until this point in time, we had a situation where you cut out big strips of the back of your head as a consequence to move up all the blood vessels and different things attached to the hair follicle. And this is now totally unnecessary. And it meant, until this point in time, most people had to almost lose their total hair before they had anything done about it. Because you're not going to keep cutting strips out of your head. You're going to wait until it's at its worst before you sort of transmigrate. So most people are getting their hair, sort of corrected when they're 40. We can now do it at 18, 19, 21. It also means, without putting too much of a spin on it, that nobody has to go bald again. Because if you can move them up when you need them, then you can do it when you're 18, you can do it when you're 28, you can do it when you're 38, and nobody needs to know that you ever go bald again.
Fantastic.
It is, it's wonderful.
Hair loss, I mean, people can suffer from it from a very young age. I mean, I know a young lad who's only 23 and he's really worried about his hair now. It's starting to thin out a bit.
The biggest percentage of people we do, and we've seen this in one of our London clinics as well, is between the ages of probably 21 and 25.
Yeah.
Now, there's a reason for this as well. People also think that people get breast implants done in their 30s and 40s. They don't. People get it done when they're 18 to 23. And the reason for this is that both hair and breasts are part of what we call secondary sexual characteristics. In other words, you use them to attract a mate. You throw your lot physically and genomally into the sort of gene pool and make the best of it to try and get your best partner to, have children in life. So a girl who feels in some way sort of shy about her breasts obviously has less confidence. So it makes more sense that she gets a correction done that suits her physiologically and psychologically at 22 than wait until she's 32. It's the same thing with hair. The most fascinating thing with hair is that we see in our London clinic that 1 in every 4 people were a male of Indian descent of an average age of 23. And now I'm sort of into, I suppose, I'm a scientist at heart as well. Why would that be happening? And the interesting thing was, we discovered that the people who were involved in arranged marriages who were in England often were connected back to the Indian subcontinent. So they had to track each other by photographs. So they had to send photographs themselves, and you're not allowed by honour to lie, back to India to try and attach a mate. And as a consequence of that, they wanted their hair on board. So it's amazing when you look at the cultural sort of aspects of all this as well.
It's fascinating. It's absolutely fascinating. What about people who suffer from, say, disorders like alopecia and things like that?
Yeah, well, alopecia itself is just a generalised term meaning hair loss. There are many different forms of it. You have alopecia areata, which is a local loss of hair that often sort of can be corrected by injection of cortisone or steroids, because they're often sort of autoimmune. And these conditions often can disappear themselves after a period of years. Yeah. You can have alopecia totalis, or global alopecia, where you can lose hair from everywhere, including eyebrows, including sort of most of the hair, including the resistant hair on the back of the head can fall out. Then you have alopecia secondary to, let's say, fungal diseases, scarring, scalp psoriasis. So if you look at hair as being a seed that's growing in a fertile soil, then there can be many things that go wrong. The first thing is obviously something wrong with the soil itself, and that's whenever you have some scalp conditions. Yeah. The second thing may be when there's something wrong with the way it's being watered, and that's the blood that's been brought to it, that some of it has, in inverted commas, toxic chemicals of DHEA. That's the precursor of testosterone. We call it dihydroxyapyandrosterone, and that's most male pattern baldness. And the most fascinating thing, I suppose, is the fact that when we have male pattern baldness, that this has been known, sort of now for maybe about 30 years. There was a dermatologist in New York that discovered that when he was transplanting skin from one area to another, that it retained its memory of resistance to this chemical. So what we've done in Ailesbury, I suppose, is perfected a little implanter, and this is a patented system where if you've got control of a single follicle, then you've got control of many other things. You've got control of placement, you've got control of direction, and a lot of the older hair that looked like it was coming from a doll's head, where you had this tufted sort of, appearance, that's because 4 or 5 follicles had to be brought up at the one time in a sort of unit that was with blood vessels, everything on board. And as a consequence of that, when it grew, it looked like it was coming out of a doll's head. Yeah. Because we can take those 4 follicles now, split them up into individual ones, and implant them in the direction that you need, then we can actually employ a different hairstyle. So we actually involve hairstylists in our final product. Yeah. So we actually empower some of the hairdressers in town to be trichologists. And as a consequence of that, we see it as our business to transmigrate or implant the hair, but we hand it over because the hair will grow back fully within 10 months. It's 100% guaranteed, and then the hairstylist can take over, and they're fantastic people. It's deciding, okay, what we need to do here is your hairline is, it needs to be in this direction, and we often bring them in at the level of implanting originally. What way do you want your hair? What way does your hairdresser want your hair to be? Because we've total control over that now, and up to this point, nobody had.
It's a terrific breakthrough, because there's men, you'd see them from years ago, and the hair would be going on the head, and they'd start pulling it over to the side to try and give the impression that they had more hair than they actually had. And these might be single men.
Sure.
So to be able to avail of a service like this is fantastic. It really is.
It is really embarrassing. It has only been in the last, I suppose, 10 or 15 years that we've seen that very short cut has now become favourably acceptable as a fashion. And of course that will change again. When we grew up originally in the 70s and the 80s, people had long hair, so people couldn't get away with that. And certainly the comb-over period is left in the older generation that came from that time. And there's no doubt about it. Actually, I think that, the short cut at the moment, I'd favour it as well. It does look quite attractive on, sort of people. But it means technically that people who have hair loss problems can technically get away with it. Yeah. But I suppose that's because the fashion of the shortcut, which came in a post-militaristic sense, because a lot of people were going, involved in originally the Bosnian Wars, Kosovo, and the British Army, sort of Afghanistan and all that sense. But this will not last forever, and we know that sort of things go through cyclical processes. Long hair will be back again in fashion at some stage, and we thought we had a regeneration of it there about 4 or 5 years ago, and people were starting to wear sideburns again, and hadn't seen them since the early 70s. But there is no doubt about it that this means will last us through into probably the next breakthrough, which will be stem cells. And there's no doubt about it. Hair transplant coming down the line, you're going to have two big advances, like most things in medicine. You're going to have stem cell and cloning. Cloning is probably of hair as close as 5 years away, you know?
Really?
Yes, it is that close. The mechanism behind it technically has been worked out. The United Kingdom is going to lead most of this. There's University in Manchester and Leeds, I think, that, or maybe it's Birmingham, that have already perfected the technique, but not as a commercial entity as yet, because all these things have to be translated into business models, because they have to compete in the marketplace. I mean, hair follicle transplant now is singly the best time, because it was costing as much as €5 or €6 per follicle, and it's down now as low as €3, you know, which is amazing. Now, one of the fantastic things about our process as well is because you can split, let's say, some of the follicles down to 3 or 4 units, it means if you need 2,000 hairs, you may need to only take out 800, you know, and then you have a transection nurse. The second thing is you don't need an anaesthetist. The third thing is the patient's wide awake. The fourth thing is they don't need a general anaesthetic. The next thing is they don't need a team of 7 people. I mean, 2 people can do this. I mean, the old method is in a way probably going to be outmoded, and I don't want to in any way seem like I'm knocking the older method, because some fantastic doctors, and even in this city there's fantastic doctors who have perfected the other technique, and at the end of the day what you want is an aesthetic result. So even though our way is simpler, easier, more user-friendly, and probably the way the whole world will go, eventually, you know, FUE will, you know, overtake the previous methods, because in essence, as a patient, why would you want to get a big lump cut out of your head and go through a situation where you couldn't play contact sports for a long period?
It's an operation you're having, really.
Yes,
isn't it? Yeah.
You know. But I mean, Ailesbury has done this to a lot of processes. We looked at liposuction, and we said, you know, this can be simplified. So we drove, I suppose, liposuction under local anaesthetic, and now it's almost like a worldwide phenomenon. Vaser in 2003, don't forget, as an ultrasonic assisted method of liposuction, was still being done under general anaesthetic, and I was one of the first people who had it done on myself to prove that it could be a local anaesthetic. Now, I wanted to take the credit for local anaesthetic being used in liposuction. That was done in America by a famous dermatologist whom I've met on many occasions, Dr. Klein, many years before that. I've also met Professor Ilyu, who now is about 83 years of age, who was the first person who invented liposuction to an extent. Well, he took it from a colleague.
I actually think I saw a documentary on him once.
Did you?
Yeah,
a fascinating guy, yeah. It's funny, I was in Paris recently with a common friend of ours. We had to go to see him sick in his house. He has a certain condition that I don't want to mention on air. But absolutely a wonderful person, and very full of the joie de vivre, and there's no doubt about it. These people all contributed to medicine in its time, and medicine changes like technology, and now we're in a situation, I suppose, where people want less downtime, procedures that are safer, usually procedures that don't involve anaesthetists. And believe it or not, a lot of my friends are anaesthetists, and I don't mean this in any discomplimentary way. It just is the mortality rate from anaesthesia per se, for many reasons, not just because of anesthesiologists obviously, but the fact that often people are sicker, they're fatter, they have cancers, the road traffic accidents is 1 in 5,000. So if you can bypass this in any way, that you can have a situation where anything can be done on the local anaesthetic, patient's awake, the patient doesn't have to undergo any sedation, then it's obviously going to be, you know, much better. But at the end of the day, the person who's doing the procedure has to have skills as well. So just because the process itself is made easier, more user-friendly, you still need a talented person, you know, sort of behind the knife.